I'm Leanne Rohr with Coshocton County Drug-Free Coalition. And just to tell you a little bit about our county, we are an Appalachian county, approximately 37,000 people, predominantly Caucasian, English speaking, with just a small percentage of African American and Mexican Hispanic population. We have 3 school districts and a career center. The poverty level is just slightly above the state poverty level. So what did we decide to do with this campaign? When we started looking at our data and we looked at the process, we decided to look strategically at what we could do to help youth in our community. We collected data through both listening sessions and school surveys, and the data told us a story. The data told us that parents aren't talking to their youth about prescription drug misuse. When we first started going into this, we really thought we were going to do something more education for students, prevention-based, but when we looked at the data, both quantitative and qualitative, we found that the story was that parents need to talk to youth. That's where our community need was. And then we created a strategic plan that led us to our media campaign. So what do we do about our media campaign? How did we get this rolling in our community? The first thing we did was meet with a marketing company. And when we met with them, we really wanted to make sure that they understood what we were trying to accomplish. We didn't want to have to do a lot of reiterations, and we wanted to make sure they understood what prevention was about and how we were going to go about creating a campaign for our county. We designed a presentation for them. We sat down with them as a coalition and we gave them a packet of information that said, this is what prevention is, this is what we want to do, and this is how you can help us get there. We received feedback, and then we created some revisions based on the feedback from the coalition to the marketing company. They provided us with a new campaign. We presented that to the EVP group, who then approved our campaign, yay, and we started working on it in the community. So some of the things that we're doing with our campaign, the tagline that we're using is one that was created by the marketing company. They don't need perfect, they need parent, start talking. And when we talked about parent, we were talking about that in the broadest sense of the term. It's not just a mom, a dad, it's an aunt and uncle, a cousin, a coach. So we wanted to make sure we were using multiple photos in our different campaigns that showed that. So we have billboards and sports sponsorship boards that will be at different venues throughout the community, as well as banners and posters. We have some swag material. So we've got some coffee mugs that we've been able to hand out at some community events that have our campaign, and then it actually has talking points on the back. Some pens that also have our campaign name and talking points. As you click it, you see different campaigns. Let's have these great wheels that are educational for parents. So it's not just about getting the word out about what the campaign is, it's about educating parents on how to have those conversations. And these wonderful little cards that we're going to put out in various locations and to share with parents that not just have the serious questions about, has anybody ever offered you prescription drugs? How do you know someone has been using? And then with talking points in the back, but also those easy questions so that kids don't always want to have those hard conversations. So it's that easy, add a few simple questions, and then you start talking about those more difficult things. We're also doing in radio, print, and our local movie theaters. So what happens next is we're going to evaluate how this is going in our community through both quantitative and qualitative measures. We'll look at how many people view websites and billboards and ads, but we're also going to look at the surveys that we're doing with our youth to say, are the numbers changing? Are youth reporting that they are having more conversations with their parents? You can see more about our coalition at Coshocton County, our drug-free Coshocton.com.